Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. We are going to answer some multiple choice question in obstetrics. Yes. Okay. Choose the one best response. Let us start with the first. A 35-year-old pregnant lady with sudden and continuous abdominal pain at 34 weeks of gestation. Physical examination shows tense uterus. Fetal heart rate was detectable but slow. What is most likely the diagnosis? Again, 35-year-old pregnant lady with sudden and continuous abdominal pain at 34 weeks of gestation. Physical examination showed tense uterus. Fetal heart rate was detectable but slow. What is the most likely diagnosis? Okay. A. Placenta previa. B. Preterm labor. C. Endometritis. D. Acute appendicitis. E. Placental abruption. Choose the one best response. Okay, everybody, try to answer before me. The best one response here is placental abruption. Why placental abruption? Because there is sudden and continuous abdominal pain, okay, associated with bradycardia, fetal bradycardia. So from the distractor here, the best one response is placental abruption. So next, levels of HCG in the maternal circulation typically peak at what level and what gestational age? Again, levels of HCG in the maternal circulation typically peak at what level and at what gestational age? A. 100,000 milli-international unit per milli at 10 weeks. B. 10,000 milli-international unit per milli at 10 weeks. C. 10,000 milli-international unit per milli at 20 weeks. D. 100,000 milli-international unit per milli at 40 weeks. E. 10,000 milli-international unit per milli at 40 weeks. Please choose the one best response. The one best response here is 100,000 milli-international unit per milli at 10 weeks. Okay, let us go to the next. An obstetric ultrasound in 18 to 20 weeks is better than that in 10 to 14 weeks for which of the following? Again, an obstetric ultrasound in 18 to 20 weeks is better than that in 10 to 14 weeks for which of the following? A. Detect major fetal congenital anomalies or abnormalities. B. Estimate gestational age. C. Screen for Down syndrome. D. Detect multiple pregnancy. E. Detect uterine abnormalities. Please choose the one best response and try to answer before me. I'm going to answer right now. The best one response is A. Detect major fetal congenital abnormalities. That's why we call it the scan for anomaly at 18 to 20 weeks gestation age. The best time for scanning for anomalies. Okay? Okay, let us go to the next. Which of the following is the most useful additional information other than last menstrual period to establish the expected date delivery? Again, which of the following is the most useful additional information other than last menstrual period to establish the expected date delivery? Okay. A. Beta HCG level at 8 weeks from last menstrual period. B. Beta HCG level at 5 weeks from last menstrual period. C. Ultrasound scan of biparietal diameter at 26 weeks. D. Ultrasound scan of crown rump length in first trimester. E. Date of first antenatal visit. Choose the one best response. Okay, the one best response here is ultrasound scan of crown rump length in first trimester. So the answer is D, ultrasound scan of crown rump length in first trimester, because the accuracy in measuring the expected date and gestational age is high with crown rump length than others. Okay, so this is the best answer here. Okay, go to the next question, please. A 32-year-old lady at 36 weeks of gestation has painless vaginal bleeding with normal CTG. What is the expected diagnosis? Again, 32-year-old lady at 36 weeks of gestation has painless vaginal bleeding with normal CTG. What is the expected diagnosis? A. Placental abruption. B. Placenta previa. C. Ectopic pregnancy. D. Preterm labor. E. Vasa previa. Okay? So, what is the best one response? The best one response here is placenta previa, with its characteristic painless vaginal bleeding. Okay? Okay. Let us go to the next. A 24-year-old prime gravida complained of decreased fetal movement. Which of the following should you do first? Again, a 24-year-old prime gravida complained of decreased fetal movement. Which of the following should you do first? A. Give her a kick short. B. Ultrasound with Doppler studies. C. Test for blood sugar. D. Blood sample for CBC. E. Simultaneous non-stress test and history taking. Please choose the one best response. The one best response here is simultaneous non-stress test and history taking. Of course, we should do history taking to know the gestational age, to know any there is medical disease or any complication during pregnancy may cause IUGR. Okay. Also her medical history, any drugs taken before, all this in history taking, plus and immediately also do non-stress test to evaluate the fetal well-being. Okay, so this is the best one response is E, spontaneous non-stress test and history taking. Again, another question, please. Which one of the following tests is appropriate for preconception screening? Again, which one of the following tests is appropriate for preconception screening? A. Renal function test. B. Rubella. C. Cervical smear. D. Prolactin. E. Endometrial aspiration. Please choose the one best response. The one best response here is B. Rubella. We know that rubella can cause major congenital malformation. Okay, so the best one response here is B. Rubella. Next question, please. At 12 weeks gestation, at 12 weeks gestation, where would you expect to feel the uterine fundus? Again, at 12 weeks gestation, where would you expect to feel the uterine fundus? A. Umbilicus. B. Symphysis pubis. C. Xiphisternum. D. Halfway between umbilicus and xiphisternum. E. Halfway between umbilicus and symphysis pubis. Please choose the one best response. The one best response here is B. Symphysis pubis. Yes. Okay, go to the next. Which of the following is thought to be a cause of hyperemesis gravidarum? Again, which of the following is thought to be a cause of hyperemesis gravidarum? A. Psychological issues. B. Overeating. C. Underlying infection. D. High level of circulating HCG. E. Hypertension. Please choose the one best response. The one best response here is D. High level of circulating HCG. Okay? Go to the next, please. Which of the following method is the correct way to calculate the estimated date of delivery? Which of the following method is the correct way to calculate the estimated date of delivery? A. First day of last menstrual period plus 9 months. B. First day of last menstrual period plus 8 months and 1 week. C. First day of last menstrual period plus 9 months and 1 week. C. Last day of last menstrual period plus 8 months and 1 week. E. First day of last menstrual period plus 9 months and 2 weeks. Please choose the one best response. The one best response here is C. First day of last menstrual period plus 9 months and 1 week. Okay, everybody? This is the last question. I hope it was beneficial for you. This is for more multiple choice question. You can visit Amazon to see my book about multiple choice question in obstetric gynecology and contraception. Also remember my other 3 books, textbook of obstetrics, textbook of gynecology, and the contraception handbook. And this is my link on Amazon here. And the other link here is my YouTube channel. And the other link down here is another scientific site belong to me. Thank you, everybody. See you.